Melaleuca alternifolia oil, also known as tea tree oil, is an essential oil that originates from Australia. You may associate tea tree oil with lice treatment, but it is also used to treat acne, athlete's foot, and insect bites. Eucalyptus globulus oil is another essential oil that comes from Australia and is used to treat congestion and relieve pain. Both of these oils are known to contain specific components that are predicted to be the cause of their antimicrobial effects. The three components of tea tree oil are alpha-pinene, alpha-terpineol, and terpenene-4-ol, and the main component of eucalyptus oil is eucalyptol. So why essential oils? Well, I'll tell you. Antibiotic resistance is likely a topic you've heard about, and it's becoming a bigger issue every day. Because of the increasing rate in the development of antibiotic resistance in bacteria, new methods of treating bacterial infections are being researched. S. aureus and E. coli are two common bacteria to cause infection in humans that are increasingly becoming resistant to the antibiotics that we use to treat them. With resistance being developed in different ways, mainly through horizontal gene transfer of resistant genes, finding new treatments against these bacteria is crucial. So this is where essential oils come in. Because of the antimicrobial activity demonstrated by both oils, much research has been done to establish their effects. In this study, we tested both oils by separating and characterizing their components and analyzing the growth-inhibiting properties. We first began by using SPME headspace gas chromatography to separate, identify, and quantify the components of tea tree oil and eucalyptus oil. We were able to successfully do this and made an interesting finding. Research had shown that tea tree oil had three main components, while eucalyptus oil only had one. But we found that both oils contained all four of the components that we were searching for, which can be seen in Table 1. The most interesting finding, though, is that both oils showed the highest quantity of eucalyptol, which, if we remember, was only suspected to be in eucalyptus oil. This finding allowed us to predict that eucalyptol may be the main component of both essential oils that gives it its antimicrobial properties. From this, we next had to ask the question of whether these oils could actually inhibit the growth of S. aureus and E. coli. So we performed a disk diffusion assay. The disk diffusion assay was also successful in this study and revealed some more information that allowed us to develop a clear conclusion on the efficacy of these oils to inhibit bacterial growth. The two-way ANOVA showed significant differences in both oils, as well as the positive control when compared to a negative control. But more pressing, we were also able to find significant differences between the efficacy of both oils on each bacteria. This significance showed that tea tree oil was better at growth inhibition than eucalyptus oil. This result made us think that tea tree oil might have a different component in it that gives it its antimicrobial properties that eucalyptus oil does not. So we continued our research by next performing an MIC assay to determine the lowest concentration of each oil needed to inhibit the growth of S. aureus and E. coli. From this assay, we were able to find the MIC values of each oil and found that eucalyptus had an MIC of 4% on E. coli and 0.5% on S. aureus, and tea tree oil had an MIC of 3% in E. coli and 4% in S. aureus. Our next step in our research was to test whether there was a synergistic effect between these essential oils and ampicillin, a common antibiotic, to determine whether they could be used together to treat infections caused by S. aureus and E. coli. To do this, we performed an antibiotic synergism checkerboard assay. The results of the assay showed a synergistic effect between tea tree oil and ampicillin, but no synergistic effect was found with eucalyptus oil. We found that in the assay, tea tree oil became ineffective at a concentration of 2.5% by itself, but when this oil dose was combined with a 1.95 microgram per ml dose of ampicillin, bacterial inhibition was increased greatly. This result shows that the use of tea tree oil in conjunction with ampicillin could greatly reduce the amount of antibiotic needed to treat bacterial infections, further slowing down the development of antibiotic resistance. To conclude, this research established strong potential of using tea tree oil and eucalyptus oil in the treatment of S. aureus and E. coli infections. It also demonstrates the potential use of natural oils in conjunction with antibiotics for treating infections, reducing the potential for bacterial resistance. Further studies should examine the potential synergistic effects of these oils with other antibiotics in other strains of bacteria, as well as in induced antibiotic-resistant bacteria, to further support the idea that the essential oils are the alternative treatment to bacterial infections.